Well, thank you all for being here today. I would also like to thank Mayor Garcetti for his ongoing partnership and the collaboration that we have between the county and the city of Los Angeles. And I want to thank our Los Angeles County Public Health Director, Dr. Barbara Ferrer, who's been serving this county tirelessly to work to protect our communities. As many of you know, Governor Newsom just released new guidance from the state public health officials advising the cancellation or postponement of any public gathering of 250 or more. In addition, they are asking that smaller gatherings ensure 6 feet of social distancing among each other. We appreciate the ongoing support provided by the state. Los Angeles County continues to take every precaution very seriously. In response to this latest announcement from Governor Newsom, we are taking the following steps in Los Angeles County to further mitigate the spread of this virus. Number one, we will be limiting our own public meetings. This includes our Board of Supervisors meeting, where we've often had as many as 250 people in this room. Out of an abundance of caution, we will be canceling next week's Board of Supervisors meeting while we determine how to best conduct the people's business while protecting at the highest level possible. We are also looking to reschedule county events that meet the large-scale criteria. We've now canceled the Los Angeles County Air Show, for example, taking place up in the Antelope Valley. I want to reiterate that these actions are not intended to create panic or fear. Rather, this is about mitigation and containment. These protective and cautious measures are being put into place to help us mitigate further implications of the virus and contain the transmissions as much as possible to protect individuals throughout Los Angeles County. We know that it is essential for the county to be able to conduct its business, but we need to do so in the most responsible way possible. We will continue to provide updates that reflect how we are making adjustments that ensure the safety and well-being of our county workforce and the public, while still serving the needs of our residents. Finally, we will continue to ask for the public's support in helping us contain the further spread of this virus. My office, in addition to the Department of Public Health, remains a resource for anyone seeking more information or clarification on the issues surrounding the coronavirus. Please feel free to follow any of us on social media for the latest updates or visit our websites. You can go to the public health website at publichealth.lacounty.gov for more information, or to katherinebarger.lacounty.gov, and we will continue to update that. As a lifelong Angelino, I know that we have weathered many storms here. I am confident that we will weather this storm as well. We will rise stronger and better prepared in the end. We will remain united as Los Angeles. But make no mistake, this is about controlling and slowing the spread. So with that, I would like to introduce my co-chair, Supervisor Hilda Solis, to give a few remarks.
Thank you, Chairwoman Barger, and I'm pleased to be joined today also with Mayor Garcetti, our sheriff, Dr. Barbara Ferrer, our city council members, our superintendent of schools, LA Unified School District representatives, and others. We're here today to provide the public with the most up-to-date information. As Supervisor Barger has mentioned, we're in an agreement with the new state guidance to cancel or postpone public gatherings of over 250 people. People, especially elderly, people with underlying conditions, pregnant women, should take extra precautions and stay away from large crowds and practice social distancing, which Dr. Ferrer will go into further detail. I also want to urge everyone to take seriously the public health guidance and not to panic, because we need to take productive steps instead of adding harmful rumors to already growing crisis. It has come to my attention that information of possible locations of patients is being disseminated through various avenues, including the social media. This is in direct violation of the law. There is good reason why the locations of patients are not being disclosed. We must maintain confidentiality, and it's important to protect patient privacy that is required through HIPAA, a U.S. law designed to shield patients from having their information disclosed without their consent. We need to listen to our experts, our doctors, our scientists during this critical time. We will do what we can to support the proposals that is being worked out right now in Congress to provide necessary funding to address the crisis. Specifically, we want to ensure that the well-being of our most vulnerable populations, who will likely be the most impacted because they don't have a good safety net, those who rely on government food programs, and children who rely on schools for lunch, and our small businesses and hourly wage workers who will need further support, such as emergency loans and paid sick leave. I'm also going to explore, along with my colleagues, that the county delay, perhaps, the April property tax for those that are impacted. We've done it for other disasters. Here's a time to do it again. We want to urge our congressional leaders to come to an agreement quickly so that we can have the adequate resources in place. Finally, I want to continue reiterating that the coronavirus does not discriminate based on race, and we shouldn't either. The growing racism against our Asian Pacific Islander communities must be stopped and condemned. I want the community to know that we are taking the situation very seriously, and we're taking steps necessary to protect the health and safety of our residents. Thank you. I'd like to now introduce Mayor Eric Garcetti.
Thank you very much, Supervisor Solis. Thank you for your leadership, and thank you to Catherine Barger, who has been an extraordinary partner and friend and a great representative not just of her district but of this entire county, the entire Board of Supervisors, to my colleagues on the City Council, including our leadership, Nuri Martinez, who is here, Joe Buscaino, and Monica Rodriguez, and to our schools. I want to thank everybody. You know, I believe in Los Angeles. I believe in this city. It is strong, it is resilient, and we have witnessed that. Through earthquake, unrest, through fires, this is a city that comes together in times of need. And I think this is one of those moments. But unlike the heroism that we saw recently during the fires, each one of us is a first responder when it comes to coronavirus and COVID-19. We're entering a critical period, and I'm confident that we will get through this together, but it will require all of us to be together and making the right decisions. This critical period, as many who are following this know, coronavirus is here. The question is, how steep a curve will it be? And your actions can help us to flatten that curve, literally buying us days and weeks to get to a moment when the virus is less of a threat. And we can each look at this. We know those folks in our workplace and our families who are saying, I'm strong enough, this doesn't apply to me, I'm going to be fine. It's not just about you. We all have people that we know are immunocompromised, people who are being treated for cancer, who have existing diseases. We have seniors and others who are most vulnerable. These are our parents, our grandparents, our neighbors, our coworkers. And the action you take or don't take could decide the fate of their lives. Your city of Los Angeles, for those of you who live in the city of Los Angeles, is acting swiftly. And today, I've just sent to my department heads direction that I'd like to share with you that takes into account the governor's guidance and goes a little bit further. There are 5 main parts of this. Commencing immediately, we've instructed that all city departments are directed to postpone or cancel all non-essential public community events or group activities that require close contact and meetings with 50 or more people. That means that all city departments are directed to postpone and cancel all non-essential public events that require that close contact also of vulnerable individuals who are 60 and over or with compromised immune systems. And so we're directing a ban on all public events or conferences as city-owned properties that are anticipated to attract more than 50 or more attendees. Second, we will also ban all events or conferences on city-owned properties that are anticipated to have over 50 people. Third, I'm ordering our general managers to develop plans to stagger visitors in public buildings to no more than 50 at a time. For those who are worried that that will create a bottleneck, we'll use best practices as we've seen in Europe and other places, if there's any lines, to make sure that people have the proper social distance between them. Fourth, we're going to ensure that hand washing and sanitizing stations are available in public properties, that we take extra care to clean all of our facilities thoroughly, and encourage folks to stay away from events if they are sick, and implement the smart social distancing practices, which means that keeping of 6 feet between. Fifth, starting now, we're putting a stop on all non-essential travel by city employees, domestic and foreign. And finally, when the emergency ends, until the emergency ends, we will start to transition board and commission meetings to accessible phone or video conference sessions. And I know our city council president announced yesterday that city council meetings at this point will be on each Tuesday. But we are closing City Hall to all non-city employees. But we will make sure that there are plans for folks to be able to testify at any commissions that we have, and the City Council, of course, will take that forward. These are common sense measures to make sure that this critical period we do everything that we can. Let me say 2 other things. I also want to call on our federal leaders to act swiftly. We've heard the testing and the need for tests. I know that Councilmember Buscaino met with the Vice President, with local leaders in Washington, D.C. just yesterday. And we're underscoring that need for us to continue to get the tests that we need. But secondly, the legislation that's been introduced in the House of Representatives today to lessen the blow economically on those who are most vulnerable today, whether that's extending sick leave, unemployment benefits, or some of the other federal programs that can help small businesses and vulnerable individuals economically get through this, will be absolutely critical. And I know the City Council is looking at what measures we can, together with our county, do to help lessen the blow that we're already feeling among many workers and small businesses. If you were going to go out to dinner, maybe you don't go out to dinner, but order out of that restaurant. Let's prop up those local businesses that are here in Los Angeles, often our friends and family, in our neighborhoods. I'm certainly going to do that with my family tonight. Order locally, even if it's online. And do those things can help LA businesses and LA workers stay strong. And finally, I want to thank the county workers and state workers who have been so extraordinary. Dr. Ferrer, again, who has just been an amazing leader for all of us in the 88 cities of LA County, and also those first responders. We will put special attention on those health professionals, doctors and nurses, the paramedics and firefighters who we see represented by our fire chiefs behind us today, and those home care workers who are the most vulnerable. And finally, I want to say, let's be good during this time. I've never, ever seen Los Angeles not come together. But whether it's rushing to stockpile things and people that we're seeing images around this country and stores. By the way, you don't need to buy water. If you live in the City of Los Angeles, Department of Water and Power water is actually, long before this crisis, even cleaner than bottled water, and is clean today. Don't lose your heads. Offer help. Say thanks to those who are on the front lines, and be smart. Make those decisions that will save a life. With that, let me hand it over to our Sheriff of Los Angeles County, Alex Villanueva.
Thank you, Mayor Garcetti, our elected leaders and appointed leaders here today. As the Sheriff of Los Angeles County, my priority is the safety of all of our residents. And this is a time where it's not about being scared, it's about being prepared, plain and simple. As the county's top law enforcement official, my duties include being the director of the Los Angeles County Emergency Operations Center, known as the CEOC. Currently, the CEOC is operating at level 2. As events have developed, I have made the decision to move the CEOC to level 1 to better address the emerging needs of the county. What this essentially means is that EOC will be fully staffed to include leaders and experts from all county departments and stakeholders whom have expertise in this type of crisis. To be clear, this is a health-driven event with the Department of Public Health and the Office of Emergency Management at the lead. However, this action allows the county emergency organization to better garner all available resources to support them. However, my personnel are on the front line, responding to 911 calls and department executive leadership. A division chief is now needed at the CEOC to improve communication, manage resources, and better monitor the situation across the entire county. This also goes towards our extended family, which is the incorporated cities, the 88 cities within Los Angeles County who rely on the County Emergency Operations Center for the coordination of supports, for requests for mutual aid, and so forth. I've also directed my department executives to suspend non-essential functions and focus on our essential functions of our custody and patrol operations. The Sheriff's Department Operations Center, which is co-located with the CEOC, will take over resources and operation management for the department across Los Angeles County. This will include moving support and specialized units into positions to handle emergency calls and care for persons in our custody. This will also include canceling large events, non-essential travel, and vacations. As of tomorrow, where we have an academy graduation, for example, we've reduced our guests to just 2 per person. We're going to honor the governor's direction towards keeping any public event of less than 250 people. So all of our executive staff, the people who normally attend academy graduation, will not be there. It will be just the recruits, their 2 guests, and myself. That's in keeping with that. We're also making plans to accommodate our administrative personnel who have the ability to support operations by way of telecommuting. In patrol, we are directing our 911 and desk personnel that when rescue emergency calls are received, to screen information by asking basic questions to assess risk of COVID-19 exposure to responding personnel. We're also going to be asking citizens to file reports both online and telephonically when practical to reduce exposure while maintaining the highest level of service. We also want to be caught in the position where we become vectors, transmitting where we have unknown exposure to the virus. The goal here is to protect the public and my personnel while providing emergency and law enforcement services. The intent is keeping the same level of service by planning and deployment of resources as we move through this situation. It is important for everyone to keep calm and know that the Sheriff's Department is committed to the public it serves and stands side by side with every resident of our great county. And with this, I'd like to introduce Dr. Barbara Ferrer, the Director of Public Health for Los Angeles County.
Good morning, and thank you so much to Sheriff and the Sheriff's entire team for all their support. You know, I want to start by saying it's such an honor to be here with what I think is the best leadership in the entire country around really coming together with a message that actually allows us to move forward in sensible ways to protect everyone who lives and works here in this beautiful place we call home. I particularly want to thank Chairwoman Barger and Supervisor Solis, who we've been working with closely since we first learned of the novel coronavirus. Their leadership at the board has been an essential component in allowing our team at Public Health to be able to move forward with the tools we need in order to maximize our actions at the community level. And their courageous stance around ensuring that we proceed with a deep understanding of what the science tells us and particular attention to protecting those who are most vulnerable, while underscoring this is not the time for racism and stigmatization of certain groups or populations. This virus knows neither geographic boundaries and it doesn't affect one ethnicity or race more than others. This is, as the mayor noted, a time for us to come together. And I do want to thank Mayor Garcetti and his entire team for their leadership and also for doing what we're going to be asking everyone to do, create a plan and implement a plan. And the plan needs to be bold and the plan needs to be aggressive. And I couldn't ask for a better partner than the mayor in making sure that our cities here in LA County have a roadmap of what it is we need to do to maximize this opportunity to reduce the spread of the novel coronavirus. I also want to thank our 2 superintendents that are here with us today, Dr. Eduardo and Mr. Butner. They have been on the phone with us for many weeks now, really trying to prepare our schools to continue to be the safe places where all of our children get a high-quality education. And that task, of course, has become more and more challenging as we've seen community spread. But for the vast majority of students that are in our schools, schools are safe places. And with the actions that both districts are taking, LACO and LAUSD, I think schools will continue to be safe places for the vast majority of our students. We have noted and have agreed that wherever there is a positive case that has resulted in exposure at any of our schools, those schools will need to close and work closely with the Public Health Department about how long they need to stay closed and the steps they need to take before they're able to reopen. But the schools have plans on making sure that should they have to close, we're attending to the feeding needs for the students who are on reduced and free meals. that they're attending to the needs of students who are medically fragile and get a lot of their services in school, and that they're attending to providing, as much as possible, quality education while children are asked to stay home. But I'm proud to be part of this team that has planned and now is executing plans that actually allow us to try as hard as possible to remove the possibility from LA County of having an explosion of cases because we didn't take action. That will not happen here. We are taking action, and in our toolkit, what we have now is what's called social distancing. In other diseases, we have vaccinations. That allows you to protect yourself, and it offers protection to others, particularly those most vulnerable. When you don't have vaccinations, you have social distancing. That is the ability that we all have, if we do this well, to not congregate and be in spaces where we're able to expose large numbers of people to a novel virus, coronavirus. So I am, again, applauding the efforts of our leadership team here. I am grateful for the leadership at the state level with Governor Newsom, Dr. Galley, and Dr. Angel, asking us, because this virus knows no boundaries, to take the collective action and close down mass events where lots of people gather and lots of people have chances of exposing others to COVID-19. We will be issuing orders here in LA County with our large ticketed events so that they are able to have a plan for closing down effectively or postponing events or having spectator-free events. We're also working, obviously, with all of the communities that have planned events and programming so that they too understand how important it is to actually not hold events that have more than 250 people attending, or events where there are smaller numbers, but at those events there's no way for people to do social distancing. We will be updating all of our guidance to reflect the directives from the governor's office, and again are here to be of service to all of our cities and all of our community-based organizations and businesses as they do their part with every single person who lives and works here in LA County to slow the spread. And as a reminder, I want to close with the two most important things that everyone needs to continue to do is people need to stay home when they're sick, stay home when you're sick. Mild illness, stay home when you're sick, and wash your hands frequently. So we still remind people that there are pretty easy steps that need more action. And with that, I thank you all. And I want to introduce our next speaker, which is Superintendent Dr. Eduardo, Superintendent Buettner from the LA's Unified School District. Sorry.
Thank you. Thank you, Barbara. Let me start with the headline, which is there has been no occurrence of coronavirus in any of our schools. And we each day work to mitigate the impact of that happening. First, we are cleaning our schools extensively, in particular those high-touch areas, the water fountains, the cafeterias, and the coffee pot and the faculty lounge. We're encouraging everyone who is in our school campus, students, staff, families, and visitors, to wash their hands. And we are encouraging anyone who might come to campus, whether they are students, staff, families, or visitors, to stay home if you have any doubt as to whether you might be sick. Each day at 5 a.m. and at 5 p.m., the lovely Dr. Ferrer and I join a call with our colleagues where we ask 3 questions. How many occurrences in LA County? Are there any known connection to those occurrences to our schools? And we've given the first responders and the healthcare professionals a list of prompts, so it's not just do you work at a school, have you visited a school, have you been a guest reader, have you been to a basketball game, to make sure we know as much as possible that there has not been an occurrence. And the third question, is it appropriate for our schools to stay on a normal schedule? We're planning, as we must do, in the event we need to close a school or many schools for whatever period of time might come, both in continuity of learning and continuity of operations, and we'll talk about that in a moment. On the continuity of learning, we're pleased that we will share today, not just with students and families from Los Angeles Unified, but throughout the state and the nation, a plan that we in PBS have developed to provide on 3 channels, programming rich instructional content that teaches to standards, that allows our students to have continuity of learning at every level, recognizing we serve a high needs population, 700,000 students spread across 700 square miles. 80% of the families we serve live in poverty, and more than a quarter of them do not have access to internet at home. So we have to provide for continuity of learning at each level in our schools, and we are doing that. That social safety net we provide to our students and families, we serve more than 1 million meals a day. As many as 17,000 students in our schools are experiencing some form of homelessness. We serve more than 70,000 students with disabilities, almost 25 of them with moderate to severe disabilities. We must continue to provide service to those families, and we're providing and planning in the event of school closure to be able to continue to do that. In addition, we provide paychecks to more than 75,000 people. We are one of the largest employers in Los Angeles. We have assured all who work for us they will continue to be paid whatever circumstances present, whether they're able to provide direct support to a student at school or not. Now, one of the things that we have to recognize is the facts and circumstances could change, and they could change quickly. But as of now, it is appropriate for schools to remain open with a few exceptions to the schedule. First is we have already implemented a plan and a practice for no community gathering, and in schools it's kind of simple. Larger than the number of students you might expect to see in a classroom, it's not happening. Not happening for staff, not happening for students, not happening for families. We've had to make some hard choices. We will have basketball games without spectators. We will have assemblies with 20 or 30 students, not with 200 students. So community gathering in schools, if it's larger than a classroom, it will not happen. Second, we are asking anyone, whether they're students, family, staff members, or a visitor, if you have been overseas or outside of this country in the last 14 days, please do not come to school. We recognize this, again, this may provide hardship, but it makes sense. We have seen already in airports, TSA screeners and others been identified with the virus, and we cannot ask our schools each day to figure out what's level 2, what's level 3, which airport someone may have transited through. So if you have any outside travel, you're not welcome right now on our campus until it's been through 14 days and you're safe to return. The last is we have canceled outside travel, outside events for students and staff. Our students will not go to public places where crowds may gather. We will find other ways to supplement that learning in the interim. So I'll go back to where we started. It is appropriate for schools to remain on a normal schedule. We are planning for the best, hoping for the worst. And as Dr. Ferrer said, the best thing we can do to mitigate the further spread in our communities is encourage those to practice good hygiene, wash your hands, keep our schools clean, and if there's any doubt, please stay away from schools. Thank you. And I would like to introduce Dr. Duardo, who helps oversee the portion of Los Angeles that is not within Los Angeles Unified, 85, 87, 88 other school districts. Thank you.
Good morning. I'd like to reiterate and make very clear that our #1 priority is the health and safety of our children. As stated by Mr. Buettner, there have been no cases of a coronavirus in any of our 80 school districts. We have 1.5 million students throughout LA County, and we are working very closely with the Department of Mental Health and others to make sure that they are safe. We are looking at each school and monitoring situations very closely. We will issue exclusion orders as needed and determine what action should be taken should a school close and at what point they would be able to reopen. Some of our priorities right now is just making sure the prevention of spread. We are doing health screenings for staff, students, and visitors on all of our campuses. Staff, students, and visitors should be reminded often to not come to school if they are ill or even ill with mild symptoms. Students and staff who present with a fever and/or respiratory symptoms are sent home immediately and separated from others until they do go home. We exclude staff, students, and visitors from schools for 14 days upon returning from travel to Italy, China, South Korea, and Iran, as directed by the CDC. We have canceled or will cancel or postpone all large gatherings such as assemblies, mass celebrations, interschool activities, spectator attendance at all of our sporting events, and looking at school open houses as well. We are outlining measures to be taken if one student or staff member tests positive for COVID-19 and exposes others at our school. School will be closed for a period of time as determined by the LA County Department of Public Health based on the dates of exposure and risk level. Schools plan to support home-based learning for as many students as possible through multiple measures that best match the capabilities of teachers and students. And school plans to provide access through appropriate distribution points for prepackaged meals. Should schools be closed, we want to make sure that all of our students who need access to meals receive it. Schools are also identifying strategies to continue medical and social services to our medically fragile students who oftentimes rely on schools for those services. We are outlining measures to be considered if there is a significant community transmission or many schools within a school district have students or staff who have tested positive. Closing schools across an entire district or region if necessary. Length of time for school closures will be based on the risk level with the specific community as determined by the Department of Health. Closing and/or limiting public access to other venues within the school district where there are community gatherings, events, public entertainment, and/or sporting events. We take the closing of school very seriously as we realize it would have a significant impact on children's safety and the health of our community as well, given that many children without resources would not have access to supervision, meals, or some of the services that are provided to them at schools. We remind everyone to stay calm during this difficult time, not to increase fear in their children, speaking to their children at an age-appropriate level about what's happening, and work together at this time. Thank you.
So that concludes this press conference, but we'd be happy to take a few questions if anyone has any questions. Oh. Well, hold on, we're going to do it in Spanish first. Supervisor Solis?
Solamente queremos decir que vamos a ponernos con las reglas que puso el gobernador y también el condado de Los Ángeles y la ciudad de Los Ángeles, que vamos a limitar las personas que pueden ir a eventos que tienen más que 250 personas. Sabemos que eso es necesario porque queremos combatir el pánico y todo lo que está pasando con el coronavirus y queremos que todos ponen atención si parece que están enfermos, que se queden en la casa, que se limpian las manos y también que no tocan su cara, ojos y también si no se sienten bien, que se queden en la casa. Y también queremos decir que vamos a, ojalá, ayudar a las personas que están impactados. Si tienen trabajo y piensan que lo van a perder, ojalá que vamos a darles ayuda con las leyes que existen en el Estado y también ojalá en el Congreso que ahorita está proponiendo un proyecto para ayudar a las comunidades impactadas. Por eso estamos aquí hoy día y si quieren más información puede ir a la página del Departamento de Salud Público para contactarse con personas que les pueden decir más o menos lo que tienen que hacer. Muchas gracias.
And actually, wait a minute, time out. Sheriff Villanueva would also like to talk about what he's doing in Spanish as well.
Como el director de emergencia para el condado de Los Ángeles, el centro de operaciones de emergencia era un nivel 2, lo elevamos al primer nivel más alto para poder responder a todas las emergencias y poder coordinar entre todos los elementos del condado y también de todos los municipios, 88 municipios que abarcan todo el condado de Los Ángeles, para estar seguros que los primeros que respondan a emergencias, que llaman al 911, siempre van a estar disponibles para servir. Y en cuanto a reportes, los tomamos por teléfono cuando podemos y vamos a durante esa llamada telefónica a cerciorar si la casa donde vamos a ir o vamos a llevar a los bomberos o los policías, la persona tiene contacto, contaminación con el coronavirus, para entonces ellos pueden determinar cómo van a responder. Si tienen que usar equipo de protección para prevenir la contaminación y así entonces estar disponibles para otras llamadas de emergencia. Y así estamos coordinados con todo el condado, pero el Departamento de Salud sigue siendo el departamento clave en este momento porque la salud es lo que está dirigiendo toda esta crisis.
Finalmente, también en español, las acciones de la ciudad. Gracias a los miembros del Board de Supervisadores, gracias a Sheriff Villanueva, los miembros del Consejo Municipal también. Estamos aquí juntos, un equipo increíble. Y esta es una gran ciudad, un gran condado, y tenemos la oportunidad de salvar las vidas de nuestras familias, de nuestros vecinos, de nuestros residentes. Con expertos en la salud pública, especialmente doctora Ferrer, para reafirmar nuestro mensaje principal. Nuestra prioridad es mantener a los angelinos informados, preparados, saludables y seguros. En la ciudad de Los Ángeles, aquí el nivel local, acabo de publicar un mensaje a los jefes de departamentos para tomar ciertos pasos, incluyendo posponer o cancelar eventos no esenciales con 50 o más participantes. Segundo, prohibir eventos grandes que ocurren en propiedades que pertenecen a la ciudad. 3, detener los viajes innecesarios por el momento, hasta abril. Agregar más estaciones de lavado de manos y desinfectantes en instalaciones públicas y con nuestros residentes sin hogares, los indigentes en la ciudad de Los Ángeles también. Iniciar en línea las reuniones de la mesa directiva y la comisión en vez de una reunión en persona. Estos pasos son importantes y todos nosotros tenemos un papel a salvar las vidas de angelinos. Thank you.